We're here with patient Lisa, and what we're going to do is show you how a fungal nail consult goes so that you can kind of appreciate what happens and sort of take a measure of how you feel about having a remote consultation. So Lisa, I know that you have fungus because you've reached out to me. Can you give me a little history regarding how long you've had it? Maybe if you've traumatized it, or was the micro trauma the cause? Just give us a picture of what's going on with your nails.
Sure. I've had the fungus at least 35 years. It's been on all my toes. It started on the big toe on one foot, and then it spread. I developed it probably when I was in my late 20s. I was a runner and I wore sneakers or running shoes almost all the time, usually with socks. And the rest of the time I had to wear closed-toe shoes for work. So that's how I think it developed. And I've tried a lot of things, but nothing's really been able to.
As a runner, did you traumatize your nails? Have you ever had your nails fall off or bleed under the nail?
I did not, no.
Okay. And have you ever had any history of ingrown toenails?
No.
Okay, great. Any history of athlete's foot?
Yes.
Okay. How bad does it get? Does it go between the toes and get scaly, or what was the quality of the condition?
A little bit between the toes, but I'd say most of it was on the sides of the feet, both feet, and also sometimes on the bottom.
And what have you tried for this so far?
For the nail fungus, I tried the topical liquids and creams that I could get at the drugstore, like a CVS or Rite Aid. I tried Vicks Vapor Rub off and on. I tried soaking them in different kinds of solutions, water-based, and
Okay. So I'm going to give you some insights now as to what we can do, and hopefully a light bulb will go off when I describe this process to help you understand why we're sort of cornering the cure, the cure from say being treated from a distance like we are right now. The first thing you need to know, and very importantly, is nothing gets accomplished without grinding. You learn that in my videos, and that is the cornerstone of the treatment. And yet, and you might ask, well, then why don't people just grind their nails and get better? And it's simply because that is, although that's the cornerstone of the treatment, there is more to it than just grinding the nails. But I will tell you qualitatively that without grinding, you really have trouble getting a cure. So why don't these antifungals that are sold online, and you've probably seen, they number in the hundreds at this point, why don't they work very well? And the reason is because each of these companies, and sometimes they're just individuals that get FDA clearance, or they just decide to compound and sell online, they have to protect themselves medical legally. They can't make it too strong, so they dilute their product with coconut oil. Now we know what works because Vicks Vapor Rub historically works. It's not a wives' tale that Vicks Vapor Rub works. It actually, online, you hear a lot of success stories. That's because it has the appropriate combinations of camphor, menthol, tea tree oil, and a way to get the medication into the nail. So that product in and of itself, we learned a lot from. If we could get the right combination of tea tree oil, camphor, and menthol, and combine it with, say, diflucan, which is a drug to treat nail fungus that is safe, we actually can hit a big win when it comes to putting the right stuff on the prepared nail. And that's what we've done. So this is a basket, and these are all the products that I work with when it comes to online consultation. The first thing I'm simply going to show you very quickly is just a moto tool. Now you can buy these online for as little as $19 or $20. And essentially, we include it in the kit as a matter of convenience, but with the right grinding cylinder, an 80 grit grinding cylinder, and supervision, you're able to create the initial circumstance where your nails have been ground down to actually start this process. So obviously it starts with this. If you have athlete's foot, I always recommend what are called Tolslin soaks. And these soaks come in a therapeutic and a daily variety. And basically, they're so simple to use. It's just a wonderful smelling pedicure soak, but this one has a little bit more antifungal than this one. It softens and it penetrates into the skin. The reason I'm talking about this almost first here is because if you have athlete's foot, you're not likely to cure your fungus, so you have to get on your athlete's foot in order to cure your fungus. Some people come to me with a lot of athlete's foot, and that is a bit problematic. So this is always recommended in combination with a very typical athlete's foot cream called Lamisil. People might say, well, why are you asking me to use Lamisil? I've tried it and it's failed. And again, it comes back to the preparation of the skin or the nails. In this case, the skin is prepared with this product. It makes the skin more supple and able to absorb the athlete's foot medication better. So while this is not exactly curative, especially for strong athlete's foot, this sets up the cure with a typical antifungal cream. So now that that's out of the way, let's talk about clear nail. So what we did, as I said before, is we took Vicks Vapor Rub and we said, okay, we're going to start with this and make it better. The problem with Vicks Vapor Rub is that it's a goopy material, so that it won't absorb into the nail if the nail's properly debrided. It simply clogs the nail a lot of times. So you need something oil-based. So with this product, it's very low in coconut oil, which is used, as I said before, to dilute products that are online to make them safer. So essentially what this is more concentrated. And we add diflucan. So you get a couple bottles of this when we send out a box. And we're going to talk to you a little bit about this black box. But for right now, this is what what we really want to get through is that this product works better than just about anything you can get. Another product that we add in the box and that I dispense is just a simple antifungal spray for your shoes. And what I usually ask is that you throw out your creek shoes or river shoes or anything that smells if you're going to go through this process, so that you actually have footwear that is clean, because fungus loves warm, moist environments. So very importantly, in your in the process of attempting to get a cure, we really want to find out, well, how bad is your fungus? And so without getting too scientific and without getting too qualitative, meaning what kind of fungus, there are usually 2 or 3 types of fungus that compose athlete's foot and fungal nails, which is pretty much the same fungus. So essentially what we do in the office is we take a culture. We actually grind off a little of the powder from the nail plate with sandpaper. We put it on a slide, and we look at that image under a microscope. And what we find are 2 cell types. The first cell type appears as sort of a popcorn-looking cell. It's simply keratin, and that is what's all over us. And so if your nails get habitually too thick, they can develop keratin, just like calluses. And then there are worms or fungal hyphae, and they look like hairs or snakes, and we quantify the fungal culture by looking at the slide and using some visualizing techniques to get a good picture of how much fungus is in the field. And that way we know it can come back mild, moderate, or severe. It's very good to know, especially if it comes back negative, because that leads us to believe that the nails are more hypertrophic. And that's not necessarily always the case, because what happens usually is they're a combination. You get a combination of both the hypertrophy of the nail and the fungus itself. So we also have created a medicated sandpaper, which has diflucan crystals baked into it, and this can be helpful with the maintenance debridement process. So let's just discuss a little bit more about the debridement process. You've had this for 35 years. Have you ever attempted to really debride your nails? I mean, really get down to the point where you've seen my videos and you've seen exactly how far I'm asking you to go. Did you ever do that in your 35 years of having this problem?
I haven't, and before I saw your videos, I didn't even really know it was possible to do that, so no, I haven't.
Thankfully, lots of even people that produce antifungals online are now catching on, and they're actually spinning their products off to include some form of debridement, usually with an emery board or something. But really, the best way to do this is to simply use a moto tool properly. So this covers a lot of bases. And some people are very confident. Some people in rural areas say, well, I can do this for my wife or myself, and they sort of can attempt to go to town. And sometimes only after, the only thing I need to do after a consult is just support them with a little oral diflucan. So I just said the O word, and you're probably thinking, oh no, here comes the oral medicine. Well, actually, no. What's wonderful about diflucan is it is safe for pregnant women, and it's safe for lactating women. So it's often given to women for yeast infections. So why do we like diflucan so much, and why do I include it in this product and I recommend the use of oral diflucan? Well, first of all, with this program, you don't necessarily need to take any oral for it to work. It's usually a time factor when it comes to laser and orals, and everything is called kitchen sink, where we're combining everything. So essentially, there's usually a time factor when it comes to treating this problem. And the more you have access to all the equipment, the faster you can go. But with good debridement and the right medications and follow-up debridement, you're in great shape. So say you're not a rural person that's real confident with a moto tool, what do? Well, that's where we come in with supervised treatment. Now, as a part of this consult, I include supervised treatment. I want to see your after pictures after you grind your nails. But more than, I'd say 95% of the patients that I consult online end up taking a shipment of what I call the black box or the package. And so basically, this is a package that includes a thank you letter. It includes an itemized list of all the contents and itemized instructions of exactly how to use this package. And inside this package is a fungal nail culture, Tolsolin powder if you need it, 2 bottles of antifungal. It includes the appropriate antibiotic ointment with instructions for how to use it to prepare the skin before the debridement. And with this package, people have basically gotten to the point where they are happy, and they're happy for life. So are they cured? Well, as you know, fungal nails come back. They tend to reoccur. And so we all know that. Everybody that's been cured with a laser says, I had the laser, and then it came back. That's because your environment doesn't change that much usually, especially if you're a runner or if you work out all the time. So the key here, and what makes our patients very happy, is we develop a maintenance protocol. After they get to the point where they've achieved either close to or a mycologic cure, they then wean off the topical and the grinding slowly. So now you're taking an oral medication and you're basically treating the fungus for a while, and then all of a sudden things get better. Let's go back to the oral medication a second, because I sort of got sidetracked. Why is diflucan the medication to go to, in my opinion, if you're going to go to an oral medication? Well, number one, because it's safe, and number two, because what happens with your body is it usually is obsessed about fighting yeast. And that's because of the diet that most of us have, where we eat a little ice cream, any sugar, any carbohydrate can be broken down into yeast. And the body usually obsesses about fighting yeast. If we can get the body to stop fighting yeast and actually get to the point where it says, okay, I don't have a problem with yeast, it then fights the dermatophyte infections much more causatively. So that's the reason for diflucan. You can take as little as 1 pill a week, which is very safe. and achieve what we're talking about. Sometimes for people that have a more moderate or severe infection, I recommend every other day for a while. And then weaning down. Ultimately, you're going to wean off these products to the point where you may use them once a month. But what you're doing now is you're actually actively maintaining your condition. Does everything make sense so far?
Yes, it does.
Okay, so essentially, to review, you've had fungus for 35 years. You've tried some topicals; they haven't worked. You're ready and brave enough, I say, to use a grinding moto tool. I'll need, aside from the before pictures that you sent for this consult, I'll need to see, after you get your black box, after pictures that show what your nails look like, so I can give the okay to start doing the rest of the performing the rest of the treatment, and then you're, like I said, you're off to the races.
Okay, makes sense, and I'm ready to go.
Awesome. It was great meeting you, and we will go ahead and be in touch with you in about the next 5 to 7 days. You'll receive all of your materials, and we can get started.